Hi, my name is Brooke McMillan. I run at LiveStrong and the LiveStrong Facebook page, and I asked you today what your questions were regarding young adult cancers, and today we have our specialist. His name is Brandon Hayes-Lattin, and he is here to answer about 5 of those questions. We received over 40 online, so we just wanted to hit the high notes here, and here he goes.
Thanks a lot. The questions were focused on young adult cancers, so I'm going to talk mostly about that, although we got a lot of other good questions too, so maybe I'll be back. I think there was a bunch of questions that had to do with the hereditary risk of cancer, or the genetic risk of cancer. What types of cancers do we worry about, and what kind of testing should somebody undergo? And I think the important themes in some of these specific questions looked at are that there are some tumors for which there are known familial syndromes. There are genetic mutations that can run in families and be associated with higher risk of colon cancer, breast cancer, uterine cancer, and others. In terms of knowing if and when you should look for one of those syndromes, unfortunately the best advice is to ask your doctor, but usually it is if there are more than a couple of a similar cancer diagnosis within the family, or if the cancer is diagnosed at a time that is earlier than it's usually diagnosed. So for instance, breast cancer diagnosed in the young adult population under 40 is a red flag to at least consider screening for these genetic mutations. There are a lot of other genetic risk factors that are being described, and in fact there are both commercial tests available for that have to do not so much with these kind of specific genetic mutations, but sort of trends, what we call polymorphisms in genes. And we unfortunately don't have enough solid data to tell people what to do with a lot of that information. For instance, you might get a test that says there's a very slight increase in risk, but in most cases right now we don't have enough data to say that means you should have a particular screening test earlier than the normal population. I think some of these questions were very specific about examples like that. For instance, in breast cancer, a young woman with a BRCA1 positive, a genetic mutation that dramatically increases the risk of breast cancer, talks about what can I do to prevent breast cancer. And again, that's a very personal decision, but can involve mastectomy or other measures before the cancer arrives. There were also questions about follow-up, particularly for young adults. So you can imagine if you were diagnosed with cancer in your 20s or 30s, and we're hoping to have a long life ahead of that, what kind of follow-up do we need? And there again can be some very specific answers to that for young adults. If they have radiation exposure, there might be cardiovascular risks to look for, again, secondary cancer risks to look for. And so having been cured of cancer as a young adult definitely is a reason to talk to your own physician about what long-term follow-up ought to be. And again, there are resources like LiveStrong Survivor Care where you can actually plug in your diagnosis or some of the treatments that you've gotten in the past and can give you some of those guidelines and recommendations. And I think the rest of the questions really had to do with adolescents and young adults. What is the definition of AYA, adolescent young adult cancer, and what are some of the hospitals and clinics around the country and around the world trying to do about that? So the National Cancer Institute and the Lance Armstrong Foundation worked pretty hard on this and defined adolescent and young adult as someone who's diagnosed with cancer between the ages of 15 and 40. There are some very unique cancer types that occur in that population that can be rare in other populations. There are programs around the country that are focusing on the needs of young adults, whether that be increasing the collaboration between the pediatric and adult communities in their hospitals so that the best practices are applied to young adults, whether that be increasing the availability of fertility information and fertility preservation techniques, and how to integrate sort of the unique psychosocial needs of young adult patients in their cancer treatment. Lance Armstrong Foundation hosts a program called the LiveStrong Young Adult Alliance, which has actually brought together about 120 organizations around the country focused on this. And actually there is a growing international effort as well. Some of the members of the LiveStrong Young Adult Alliance are from other countries. The National Cancer Institute equivalent in Canada is hosting a meeting this spring in Toronto to launch the same sort of initiative through Canada. And there are other international efforts underway. So I think that's kind of a summary of questions. I'm happy to do this anytime, and good luck to y'all.